Hi everyone, welcome to Research MD. This is Dr. Pramil. I work as a program director in internal medicine residency program, also an associate professor of medicine, chief medical officer. So we are starting series of videos on how to tackle the in-service training examination. Very, very important. A lot of people usually don't understand when they go to a residency program and the importance of it, okay? So we'll talk about the importance before. So today we're going to start the nephrology, and we do a series of most important topic in the in-service training exam. It's actually called ITE, so you can impress your program director. Okay, today we're going to look at the topic is called autosomal dominant polycystic kidney disease, or ADPKD. Okay, now, so the question is going to be on how to diagnose it. So what is the next step in the diagnosis? You always pick the ultrasound. Okay, you will see options like ultrasound, genetic testing, MRI, CT scan. You don't always think it's an ultrasound. That's a diagnostic imaging test. You have very high sensitivity and specificity. Now, it's important for us to look at what do you find. You find cyst in the ultrasound. That is the one you have to look for. Okay. Now, there's a criteria for diagnosing ADPKD, how many cysts and all that. So if you have a family history, okay, if a patient came in, had a family history, and usually they have hypertension, hematuria, renal failure, you do an ultrasound. Let's see what you're going to find. Let's say if you're in the age category, plays a very important role. If you're aged between 15 to 29 years, you should have 3 or greater unilateral or bilateral cysts. Okay, then you can say the patient got autosomal polycystic kidney disease. Now, if you're between 30 and 39, the same thing, 3 or greater unilateral or bilateral cyst. Okay, the thing you also need to remember, but if you're between the age of 40 to 59, you need only 2 cysts, or greater than 2, could be unilateral and bilateral. Okay, now, the next thing also you need to know, when somebody if you don't have a family history and you find ultrasound, again, you look for the bilateral renal cyst. You also look for hepatic cyst in those people. Okay, that's very important. Now, this is a great picture. Remember this picture worth 1,000 words. Look at all the cysts you have. Okay. Now, the mistakes, one of the common mistakes people usually do is when the question is asking about ADPKD diagnosis, they jump into genetic testing. So please don't do that. Genetic testing is not relevant. It's not a very great test up here. You always do the ultrasound. Okay? Do not pick the answer as a genetic testing. Okay, now we have a nice diagram up here, flow chart. If you look at it, you can say first you look at the patient does the patient have family history? Okay, if there is positive family history and if you have hypertension, you have flank pain, you do the renal ultrasound, and then you go by the age-based criteria. Okay, if it is 15 to 29, 3 or greater, 30 to 39, 3 cysts or greater. When you're like 40 to 59, or you need only 2 cysts. Okay. Now let's look at the other arm. There's no family history. You got hypertension, flank pain. You did a renal ultrasound. You got bilateral renal cyst. You also look for what? Hepatic cyst. Okay. So the key point in this in-service training exam for nephrology is the diagnostic test for autosomal dominant polycystic kidney disease is what? Ultrasound. Okay. The most common mistake is what? People pick genetic testing, so don't do that. Okay, so if you like this video, please like, share, and subscribe so we can make more videos out there for you. Okay, thank you so much.